Okay, good morning, everyone, and thank you for joining us for today's webinar. My name is Jessamine, and I'll be facilitating the Q&A today. First, our panelists will introduce themselves and provide some opening remarks. I'd like to start by welcoming SickKids President and CEO, Dr. Ronald Cohen, to begin.
Good morning and welcome, everyone, and thank you for joining us today. What we're going to do today is we will provide you with a brief overview of COVID-19 and how it relates to children, and then we will do our best to answer your question. I think it's important to know that everything we say is in the context of what we know as of today, June 17th, 2020. These have certainly been extraordinary times of unprecedented complexity in all aspects of our life, whether it's within the healthcare setting or in our personal lives. And it continues to be a dynamic situation. Some of what we may say today could be very different in a few weeks and or months from now. Over the last few weeks, a number of experts from SickKids and Unity Health Toronto, with input from scientists at the University of Toronto, as well as our own family advisory network, have worked on a guidance document that provides details on the conditions that we believe will facilitate a healthy and safe return to school for children in Ontario. And we have been working very closely with the Ministry of Education on this topic. Our advice is grounded in the best available medical and scientific evidence as we know it today. But I think it's important to acknowledge we are not educators of elementary or secondary school of children. We don't profess to understand the operational and logistical considerations in running a classroom, a school, or even a school board. However, we hope that our advice on what we believe would facilitate a healthy and safe return to schools is beneficial to parents, families, policymakers, and the many education stakeholders who must implement measures to ensure a safe return to school so that the growing mental, emotionally, and physical needs of our children as a result of this pandemic can be met. 3 months ago, we were all told to stay home as much as possible. Schools closed, malls closed, restaurants closed, and really only essential services remained open. This was a very important step to take. And we have successfully flattened the curve, and our preparations have ensured that the healthcare system has not been and continues to not be overwhelmed by COVID-19. However, we now have to mentally and practically move to the next stage of this pandemic. And I'm not talking about the stages of opening up the economy. I'm talking about the next stage of changing our approach, our thinking, and our behavior about the current pandemic situation. We have to accept and internalize that this virus will stay with us for a very long time, a year, maybe even longer. And we have to accept that we will not be able to eliminate the risk from getting infected from the coronavirus. So we have to stop living in fear from the virus. And most importantly, we need to move on with certain activities of our life, keeping in mind, while we cannot eliminate the risk, there are a lot of measures that we can put into place to mitigate the risk. And as part of this shift in our mental and practical approach to the pandemic, we strongly believe that it is of utmost importance that we open schools in September. The impact on the mental, behavioral, and developmental health of children not going to school, not being exposed to in-person teaching, and not being with their friends and peers is something that myself and many of my colleagues in pediatrics are literally losing sleep over. It is difficult to capture this in numbers and data, but yet we are significantly underestimating the impact this has on children of all socioeconomic classes, but particularly the ones who are coming from vulnerable living and family conditions. While we need to identify measures that bring children back to school in a healthy and safe way, there's a fine nuanced difference to the meaning of safety for the following reasons. Number one, children by and large do not get very sick from coronavirus. We now have lots of data from literally all around the world, and you will hear more about our own experience from my colleagues in a few minutes. And then there's a slightly controversial question of what role children actually play in transmitting the virus. Although kind of contrary to our basic understanding of how viruses that are transmitted via droplets, there's increasing evidence to suggest from different countries around the world who have already opened up schools, who have already opened up the economy, that children may in fact not be the super spreaders that we thought there would be. So while we have to take all of these current data still with a grain of salt as of today, these studies looking at children and their ability to transmit the virus do not suggest that they are responsible at least for a high transmission of the virus. So if we all take a step back for a minute and think about safety in general, it has never really been 100% safe to send children to school. There's always been a risk of contracting some infectious disease, whether it's the flu, the norovirus, or other viruses. Children are at risk of being injured on their journey to school or from school to home. And then there are the risks of mental and physical harm from bullying. These risks have and will continue to be present, though of course we can manage them and put mitigating factors in place to deal with these risks. And this is exactly the kind of approach we have to take now on moving forward as we are living with this current pandemic. I will now pass it over to Dr. Friedman, who will speak a little bit more about COVID-19 in children.
Thank you, Ronnie. As you mentioned, what we know about COVID-19 is constantly evolving. So what exactly do we know? Fact number one, COVID-19 appears to affect children in much lower numbers. In Canada, children and youth under the age of 18 years make up less than 5% of the total cases. And our experience at SickKids supports this. Of the approximately 5,000 symptomatic children tested for COVID-19 at our hospital since March to the present, less than 30 children have tested positive for an overall incidence of less than 0.8%. Of interest is that we have also now tested over 1,500 asymptomatic children who were about to undergo a procedure at our hospital, and none of the 1,500 have had a positive nasal COVID swab so far. Fact number two, COVID-19 causes a less severe presentation in children. Internationally, the numbers of hospitalizations, admissions to ICU, and deaths in children have fortunately been extremely low. At SickKids, only 7 COVID-positive children have required admission, and often for reasons incidental to their COVID infection. All have done well, and no one required ICU admission. So what about the hyperinflammatory syndrome? Separate to the usually mild acute illness that COVID-19 tends to cause in children, there does appear to be a rare but more serious condition temporally related to COVID-19, which has been reported approximately 3 to 5 weeks after the peak of the surge of community cases in various parts of the world. This is presumed to occur as a result of a child's overzealous, delayed immune response, leading to hyperinflammation in various parts of the body. In some cases, this can have a similar presentation to another unusual childhood condition called Kawasaki disease. Only a minority of children reported in the literature with this hyperinflammatory syndrome have actually tested positive for COVID-19 on the nasal swab, but most who have been tested are positive on the blood antibody test, suggesting a recent but not currently active COVID-19 infection. Interestingly, our experience with the hyperinflammatory syndrome in Toronto so far has been quite different from that described in Europe and New York. At SickKids, while we have seen a cluster of children with high fevers and high inflammatory markers on their laboratory blood testing, as well as an increase above our normal numbers of Kawasaki disease, both typical and incomplete cases, we have not seen the severe shock or ICU type of presentation that has been reported elsewhere in some case reports. We had approximately 24 children admitted to SickKids for investigation for this syndrome. All of them tested negative for COVID-19 on the nasal swab, and we are still waiting approval to do the antibody testing. They were all safely discharged from the hospital and were followed up in our clinic. The vast majority of children with this condition reported from around the world have responded well to treatment, and these treatments are similar to what we are very familiar with using in Kawasaki disease, for example, intravenous immunoglobulin, steroids, and aspirin. And here in Toronto, all of our patients have responded well to these treatments. Finally, I'd just like to note that even as we navigate COVID-19, it is important for babies, children, and youth to continue to receive routine care, including immunizations from their primary care providers. Many providers are continuing to provide the necessary service and also include virtual care options, which are now available from home. Our emergency department, as well as our inpatient and outpatient areas at SickKids, remain safe. We ask that parents and caregivers do not delay urgent care because of fears of catching COVID-19. SickKids is taking precautions to maintain an environment that is as safe as possible for all of our patients, families, and our staff. So I'm going to stop there. Happy to answer any questions at the end, and I'm going to pass it over to my colleague, Dr. Michelle Science. Thank you.
Great, thanks, Jeremy. So I'm Michelle Science. I'm an infectious disease physician at SickKids, and I'm the medical advisor for infection prevention and control here. So Ronnie has provided an excellent overview of the importance of children returning to school, and Jeremy's spoken a little bit about the lower infection rates and general mild illness we're seeing in children. I'm going to switch gears and talk about some of the measures that can be put into place to reduce the infection risk when children return to school, realizing that we can't eliminate the risk entirely. So I'll start by talking about face masks, as this is one of the areas where advice has changed over the course of the pandemic, and I want to touch on some of the thoughts around how the guidance relates to children. So we know that masks may reduce transmission from individuals who are symptomatic and shedding the virus. However, the extent of this benefit is really unknown, especially in asymptomatic children. As Jeremy mentioned, we continue to learn about how children may not contribute as significantly to transmission compared to adults. And because of this, and the fact that there may be downsides to wearing masks, we have suggested that masks should not be required or when children return to school. And some of the points that led to this is really that wearing a mask is only potentially beneficial if it's done properly, and if worn incorrectly, it could lead to increased risk of infection. You can imagine in younger children, masks can be irritating, which may lead to increased touching of their face or eyes or nose, which could increase the risk of infection. So really, it is not practical for a child to wear a mask for the duration of the school day. Of course, we need to continue to monitor the situation and reevaluate as we get evidence and learn from other countries. But I would highlight that several European countries have had children successfully return to school without face masks, although a number of other important infection prevention measures have been put in place. So next, I'll touch quickly on social distancing, or physical distancing as we like to refer to it now. So the objective of physical distancing is really to reduce the likelihood of contact that may lead to transmission. And this has been a widely used strategy during the pandemic. But close interactions such as playing and socializing is really central to child development and should not be discouraged. So while I'm sure school will look different upon return, and we have made some recommendation around measures to put in place to avoid prolonged close contact, like separating desks for students and avoiding large assemblies. Overall, we think it's not realistic or in children's best interest to completely avoid all close interaction and play. One area that we do think is very important is hand hygiene or hand washing. And this is really one of the basic infection prevention and control practices. And studies have shown that by increasing hand hygiene in school, sick days can be reduced. And the final point I wanted to touch on is really making sure that symptomatic children aren't going to school and they get tested to confirm infection. In order to prevent spread in classrooms, it will be really important that children stay home from school when they're unwell and also get tested to confirm if they have COVID-19. So these are just some of the recommendations that are included in our document. There are several other important considerations, including cohorting, environmental cleaning, ventilation, that are summarized in the document. But I want to emphasize that it's not one specific measure that is going to reduce the risk alone. It's really the bundle of measures that is important. So with that, I will pass it over to Daphne to discuss some of the mental health impacts of the pandemic and school closures.
Thank you, Michelle. So I'm Daphne Korchak. I'm a child and adolescent psychiatrist at SickKids, and I'm leading a study examining the mental health of children, youth, and families during COVID-19. The public health measures have posed significant risks to mental health by keeping kids disengaged from their friends, their teachers, and their sources of strength and support for a prolonged period of time. When children left for March break a few months ago, they were completely unaware of what was to come. Many were imagining the events in their futures, some of which they had been looking forward to for years: school and leadership activities, end-of-year trips, sports teams, graduations, summer camps. As they returned to school this week to clean out their desks and their lockers, instead of feeling the joy and pride and excitement that they had imagined, many were feeling lonely, sad, and disappointed. In Ontario, like in many regions, news of the extensions to lockdown measures have occurred episodically in intervals, which from a public health response perspective has been understandable. However, for children and adolescents, these staggered announcements have been experienced as serial disappointments. As these eagerly anticipated events have approached and then been canceled, kids have had a repeated experience of loss and grief. In my clinical practice, I'm seeing these up and down waves of hope and disappointment taking a significant toll on children and their families. So although there have been some positive stories of children who are coping reasonably well, a growing body of research tells us that a significant proportion of children have experienced increased depression, anxiety, irritability, and seem less able to buffer day-to-day frustrations compared with their own pre-pandemic selves. At SickKids, we have recently launched and are leading a large study to examine the mental health impacts of the emergency measures, including school closures, as reported by children and youth and families. We've included researchers from other centers across the province, including Holland Bloorview, Queen's, McMaster, and London. And because we're including the voices of kids and families with known mental health and neurodevelopmental disorders, as well as those without these disorders, we will be able to better understand the impact of COVID-19 and the public health emergency measures on vulnerable as well as otherwise healthy children. Worldwide, there's very little data about the effects over time, and for that reason, our aim is to follow these children and families over the coming months through their return to school so that we can learn about these impacts and learn where we need to direct mental health care interventions and services to ensure that they are targeted to what's needed and are delivered where they will be the most useful. Thank you. I'll now pass it over to Dr. Birkin.
Thank you, Daphne. I'm Catherine Birkin, a pediatrician and senior scientist at SickKids. And as Daphne discussed, the public health measures implemented to mitigate COVID-19 have had significant adverse consequences for the health and well-being of children and their families. Some of the unintended consequences include adverse impact on children's development, their behavior, and their physical health, in addition to the mental health impacts that Daphne described. These include disrupted routines, including sleep patterns, reduced physical activity and outdoor play, major increases in screen time, reduction in their social interactions with peers and other trusted adults, putting children at risk of poor health, behavior, and emotional problems. Importantly, leading organizations such as the World Health Organization have highlighted concerns about potential impact of lockdown on child poverty, family discord, exposure to domestic violence, and child abuse and neglect. Schools are sometimes the safest environment for children. We are seeing evidence of the effect of the public health measures on child health and well-being around the world. And as a pediatrician and researcher, I am working to better understand the impact of these public health measures on child health and well-being throughout the pandemic. Our group is leading research through the Target Kids Practice-Based Research Network in Toronto, in collaboration with parents, pediatricians and family physicians, mental health experts, and other leading researchers at SickKids, Unity Health Toronto, and University of Toronto. We aim to understand the extent to which COVID-19 is occurring amongst children and their families and the severity of the illness. And we also aim to learn about how the public health measures have impacted child and family health and well-being. We're working hard and hoping to share our learnings so that we can better support children and their families. I've been listening to parents in our study and in my clinical practice. Parents are telling me that their children are struggling with the lack of routine and structure. Parents have been challenged with supporting their children with remote learning. Parents and children are feeling stressed about the uncertainty. Children are sad, irritable, clingy, and lonely, and parents are worried about their health and well-being. Parents tell me that their children need the consistency, social interaction, learning, and supportive environment of school. School is fundamental to child health, development, and well-being, and I strongly believe we can support all children and families in a healthy and safe return to school.
Thank you, Dr. Birkin. We're now ready to go to live questions, and I would invite
Actually,
all our panelists.
Can I
Yep, go ahead.
do my closing statement, and then we are ready for your questions. So thank you for joining us today and for listening to our presentation. As you can hear, we are very, very passionate about what is best and what is in the best interest of our children. And if there's one takeaway that I ask anyone listening to this to share with your readers or viewers and friends and family, then I would say this. The current pandemic crisis has tested our society and us as individuals in a fairly unprecedented manner. And yet, by and large, it has brought out the best in us, has allowed us to flatten the curve and keep COVID-19 under control. It is now time to accept that this virus will be around for many more months, and we need to focus our attention to the silent voices of our children, who have been isolated for several months away from their friends and peers. There are many ways to mitigate the risk of the coronavirus infections, and we continue to work together. And if we do that and listen to one another, we can protect the well-being and health of all of our children and allow them all to thrive in their own special ways. Thank you for being with us, and we are happy to take your questions now.
Okay, so we are now ready to go to live questions. I would invite all our panelists to turn their videos on for the remainder of the webinar. For the members of media in attendance, please raise your hand on Zoom and we will unmute you to ask your question. Everyone who asks a question will have an opportunity for one follow-up, so please indicate which panelist you think would be best suited to answer. And we'll do our best to get to as many questions as possible. The first question will come from, I think we're just waiting for some people to put their hands up here. So we'll give everyone a moment. Okay, the first question comes from Colin DeMello with CTV.
Hello, good morning to all. I just had a question about a timeline and what you think is appropriate. Obviously, kids are looking to get back to class in September. Parents are looking for that as well. Is that a reasonable timeline or a reasonable expectation from where we're standing right now?
Yeah, so the answer to this would be yes. It is our expectation that the guidelines we have publicized today will help guide of how to best open schools in September.
Follow up?
And just if I could follow up, so what would be the mitigation strategy should there be a single case of COVID-19? Would it be similar to daycares where the expectation is one particular cohort would be isolated? That's my child behind me, by the way. One particular child would be one particular cohort would be isolated, or would it be an entire school that would have to be shut down? What's the protocol in your mind to ensure that the safety of the other children is intact?
Michelle, do you want to take this?
Sure. So I think it will be important that schools and public health units work closely together to have procedures in place when a child is diagnosed with COVID-19. So there should be plans in place if a child feels sick at school to have them safely separated from other children and staff, and have families and caregivers contacted to pick up the child. Case identification through testing will be really helpful to follow up on potential close contacts. I think to the extent possible, the goal would be to ensure educational continuity for students, but I think that schools and public health units will need to work closely together to make those decisions.
Okay, the next question. Oh. Thanks, Michelle. The next question comes from Haley Cooper with News Talk 1010. Please go ahead.
All right, can you hear me?
Yes.
We can hear you.
Perfect, thank you. Just following up on Colin's question. So if one child is diagnosed, this panel of experts doesn't have any recommendations in how school boards and schools handle that, whether it's, isolate the cohort or close an entire school?
No, let me clarify this. So I think once you identify a case in school, whether this is, as a matter of fact, a child or a teacher, we would expect, and I'm sure it will occur, that public health works closely together with the school to go through a contact tracing and testing strategy that would identify the people that are at higher risk, who have been in closer contact with either the child and or an adult staff member. And throughout this process, you would then be able to identify how much restrictions you need to put in place in order to manage that positive case. There is no blueprint in terms of one size fits all approach. And I think one needs to be really carefully approach one positive case through testing, through contact tracing, in order to mitigate an immediate school closure, for example. Okay. But I think we will be there in September to approach it that way.
And my follow-up is regarding cafeterias. You mentioned that lunch breaks should be staggered, but we wanted to know about cafeteria food. Should that not be served? Should students be coming to school, students of all ages coming to school with a pre-packed lunch?
Michelle?
Those are great questions. So we specifically haven't gone into some of the implementation considerations because they're going to vary depending on the school. So really these are broad recommendations, and we want to make sure that children are washing their hands before and after eating, and having them eat in their classroom would be a strategy to prevent too much mixing of students with other students. So it's hard to make every school is different, and the situations are going to be different. So the implementation at those schools will have to be considered on a case-by-case basis.
Next question comes from Tom Blackwell with the National Post.
I think you're on mute.
The next question comes from Tom Blackwell with the National Post.
Hello? Can you hear me? Oh, okay, great. This question, I guess, would be for Dr. Science. There's been a number of studies in recent weeks on mask use by the public, which, often involving mathematical modeling, but which seem to suggest that there is a definite benefit in terms of curbing transmission of this virus. I understand, it might be difficult to get young kids to wear masks properly, but why not recommend mask use, say, by high school students who presumably could be instructed on how to properly use them?
Yeah, great question. And I think we acknowledge that some parents and children may choose to wear a mask to school, and we certainly wouldn't discourage that. As the evidence continues to come out, it's something that we will monitor and evolve and reevaluate the evidence. So I think as a general statement, we don't think that masks should be required. But of course, there are some family members and some families and children that may choose to wear a mask, and I wouldn't necessarily discourage that.
Follow-up?
Oh, yes, thanks for that. The follow-up, I guess, perhaps for Dr. Cohn is, or any of the panel members, some of you made some fairly compelling arguments about the mental health effects of school closures on children. And I think you're strongly recommending that school be resumed in September, and the parents send their kids to school then. Do you think, though, that schools could have been opened any earlier than September? Has this been taken sort of too far, I guess, or is this the appropriate approach?
So my answer to this would be the following, Tom, and thank you, actually. It's a good question to ask. I think we all agree that when this pandemic crisis started, closing schools was the right thing to do. We simply didn't know even close to as much as we know today about what this virus is going to do, what the impacts are going to be. So I think it was the right thing to do. And I also think that in order to create a really healthy and safe environments for kids going back to school, it will require quite a bit of preparation on the operational aspect of schools. So not opening schools for 3 weeks in June, I think simply from an operational perspective was not even doable in order to do it under the guidelines that we have put together. So I don't think it was necessarily the wrong thing to do, but now we know more. Now we also know, and while we have been talking earlier about this may be around for a long time, I think we are now at a point where we know it's going to be around for a long time. And the alternative of having children not in school for months and potentially a year or two are just untenable.
Thank you.
Next question comes from Dave Woodward with 640 Global.
Hi, thank you very much for your time. This question is for Dr. Science, and really just a clarification. You were talking about testing for kids being imperative. Are you talking about testing for those who are sick or testing for all 2 million students in Ontario?
That is a great question to clarify. Yeah, it's in the context of symptomatic children, so case identification so that contact tracing can be done appropriately.
Okay, my follow-up question is talking about physical distancing and masks, both things that have been recommended by Public Health Ontario as well as Chief Public Health Officer of Canada in terms of keeping the virus at bay. Those two things seem to be not as important in your recommendations. Can you explain why?
So again, a good question, and I wouldn't say that they're not important. So I'll speak to the physical distancing first. So you'll note in the recommendations that we do have a number of strategies included that involve physical distancing to reduce the risk of having many close exposures. So things like in the classroom, having the desks separated and avoiding large assemblies. So it's still an important part of our recommendation. It's just the strict emphasis on physical distancing that we're saying isn't really practical, and it really is important for children to have those close interactions, when they're playing outside. And so it's not about saying that, physical distancing is important. It has been a very effective strategy in this pandemic, and there are certainly components of physical distancing that will be important in when children return to school. It's really that strict emphasis that we want to get away from. And in certain scenarios, like for the younger children, physical distancing is really not possible, which is where more of a cohorting strategy comes into place. And with respect to the masking, I think I spoke to that a little bit earlier on. It's really about the practicalities about masking, and the recommendations from public health appropriately are weighing the risks and benefits of the general population as an additional measure to control the pandemic. It does make sense to recommend masking. When you look at how you apply that to children, there is a bit of a practicality issue about making sure children are wearing them appropriately in the school environment. So it really comes down to some of those decisions. I don't know if anyone else has any comments to add.
Yeah, so Dave, maybe I can just elaborate. I think from a even practical point of view, depending on the age of the child, obviously adolescent children are probably much more capable of putting on and taking off a mask the correct way. But if you really look at younger children, what you probably are going to see, and you may even experience this by yourself, that sometimes the mask doesn't sit quite right or is somewhat uncomfortable, then you risk of going with your hands into your face, trying to readjust it, and could potentially even increase the risk of any kind of contamination. So that's why we are trying to not say it's not important, but we are trying to de-emphasize some of that risk and put a bit more focus on, I know that sounds incredibly mundane, but washing your hands and not putting your hands in your face is an incredibly important and critical preventative measure that we all have to learn, even more so than we already have, in order to mitigate risks.
Thank you.
Next question comes from Christina with CP24. I think we're just trying to get you unmuted, so it'll be 1 second. Go ahead.
Hi everyone. Can you hear me okay? Yes, I think you can. Thanks for taking my question. I apologize if this has been addressed already. I had to jump in and out of the Zoom. My question is, I know that SickKids provided guidance to the Ministry of Education when it came to the reopening of daycares. So I'm wondering, in terms of this report, was this requested by the Ministry of Education? Did SickKids decide to compile this as a research document to provide to the Ministry of Education? And have you heard from them as to if they're going to accept your recommendations?
So we have had very productive conversations with the ministry around the opening of the schools, and they have obviously seen our document and have reacted towards the document in a very positive way. We have not directly been in collaboration or contact around the guidelines around daycare per se. I think a number of the points we are making in this document are potentially applicable to daycares, of course, but we have not been in direct contact with the ministry about daycares. It was all about school.
Oh, sorry. I guess what I meant is, I know that when the Ministry of Education made their announcement about daycares, they said they had consulted with SickKids, so it may not have been you specifically. I think that's everything. I guess I'm wondering, do you have any indication from the ministry as to if they will, I know this is a question for them, but you said there's been positive communication. Do you expect they'll implement these recommendations for schools?
I think the ministry is still working on their final documents. So I don't know exactly how much, but I think a number of our recommendations resonated with them very positively.
Okay, thank you.
Next question comes from Tina Yazdani with City News.
Hi there, can you hear me?
Yes, go ahead.
I'm just wondering, we've seen some of the strict guidelines and rules come out in other provinces. Has there been any talk about the mental health impacts of children going back to a completely different environment than one they were used to prior to this?
I'm sorry, I missed the last part of the question. Would you mind repeating it, please? I'm sorry.
Sure. I was just wondering if there's been any discussion about the mental health impacts of children returning to school in a completely different environment than one that they were used to.
Daphne or Catherine, do you want to speak to this?
Sure, I think it's a good question. I can start, Catherine, if you want to add. Well, I think there are a couple of things to consider. First, it's important to keep in mind that the majority of kids have missed going to school and they want to return to school. And so until very recently, many were hoping that they could still return to school this year. Second, I think we have to remember that many of the difficulties that we're seeing are as a result of the absence of school activities and seeing friends and teachers. And so returning to school and to as many of their activities as usual will go a long way to addressing some of these challenges. And then I think with respect to anxiety or settling back into school, part of what contributes to anxiety is all the uncertainty that we've had to manage over the last few months, which in turn contributes to the anxiety or the uncertainty about return to school. So, during these times, it's normal to feel a bit anxious. But at the moment, parents and children don't know what to expect. What will a return to school look like? How will classrooms be different? And so being able to provide information to families as far in advance as possible will be helpful, because once parents and kids know what to expect, they'll be able to prepare themselves and have a greater sense of control over their preparation and their anxiety.
Yeah, I would just, sorry, thank you. I totally agree with Daphne's comments. I would just say that in the guidance document, we've discussed, provided some statements around flexibility in program or school enrollment for children that are transitioning to a new school or program to address some of those increased anxiety that Daphne was discussing. And also increased in-school educational and mental health support, especially for at-risk populations or diverse groups. We've also recommended, so to really address your question about ensuring that students, children and youth have the support that they need upon return to school.
Thank you for that. I just also wanted to ask about something that was said earlier in the press conference, that children aren't the super spreaders that we once thought they were. I was just wondering how concrete the data is to back that up.
I think this is probably the most controversial point, and that's why I mentioned it with a grain of salt. What we do see, though, from studies, whether they're from Europe or other parts of the world, including Australia, is that generally, what we see is that the children get infected from adults and not the other way around. Now, I think the reason why I'm saying this with a grain of salt is children probably have not been out in the public as much as usual. So I think over the next few months, we will learn more about it. But even in the areas in Europe or Australia, in Ireland, for example, where children got back to school and were normal life, quote, has started, the transmission seems to be much more frequent from an adult to a child than the other way around. I think we'll learn a lot more about this. But I think what's also fair to say is that children do not appear to be the super spreaders that they usually are. I mean, we know from the flu and from many other respiratory viruses that a child often acts as the super spreader, and that is something that we really have not seen. So I want to clarify, I'm not saying, or none of the studies are suggesting that children do not transmit it at all. It's just not at the high frequency than any of us would have expected.
And just a quick reminder that the Q&A portion will end in about 10 minutes. The next question is from Chris Rushawy with the Toronto Star.
You're on mute, Chris.
I think we'll go to the next in the meantime. The next question is from Jackie Dunham with CTV. Can
you hear me?
Now
we can hear you.
Oh, okay. Hi, good morning. I was just wondering physical distancing rules. I know Quebec has released some new physical distancing guidelines, and under they just they're apart from each other.
Jackie, I think you're cutting out a little bit. Could you repeat your question?
Sure, yeah. I was just wondering if you think the new regarding and how children should remain 1 meter apart from each other and 2 meters apart from adults, if those would be to follow.
Jackie, could you come closer to your speaker? I don't think we can quite hear you.
Oh, I was just wondering if you think the physical distance should remain 1 meter apart from each other and 2 meters apart from adults, and if that would work here.
Jackie, I'm afraid this is cutting out a little bit.
That's okay. That's all right.
Okay, we'll move to the next and we can come back. Our next question is from Claire at Today's Parent.
Hi there. I was just wondering if the recommendation, I know we're hearing you loud and clear that kids should get back to school, but does that apply to families where kids have an underlying health condition, or maybe the parents have a condition that puts them at higher risk?
Jeremy, do you want to take this?
Thanks, Claire. I think that is an excellent question. And obviously at SickKids, many of our patients are in that position where they do have an underlying chronic disease or are potentially immunocompromised. It is interesting that looking across the world in terms of the experience so far, for the most part, children with underlying conditions have weathered this virus relatively well. It is true that when you look at a few of the studies looking specifically at the few children that have required intensive care treatment, that there is a disproportionate number who do have an underlying chronic disease. So there does appear to be some increased risk, but perhaps probably not that different from other respiratory viral diseases like influenza, for example. So certainly children with chronic diseases are also at much higher risk if they contract those type of respiratory viruses. At the same time, we also know that those families are really, really struggling with the isolation and having to stay at home. And what we hear from our families is that many of them are really in crisis. So what we've encouraged in this document, and there is a section specifically discussing this patient population, what we have encouraged the schools is to really liaise very closely with the families and with the healthcare providers for these patients in such a way that the environment can be adapted to make it appropriate for those children, because we would like to see a situation in September where in fact all children, regardless of whether they have an underlying disease or immunocompromise, are at least offered the option of returning to school in a safe fashion. Certainly some parents might choose not to take that up initially, and those children should be given a virtual option. But we would strongly encourage the schools to try and create a situation where that opportunity is available for all children right across the board.
And just what if the parent has an underlying condition that puts them at risk?
So again, a good question. I think again, it's certainly going to be somewhat case by case in terms of just how significant the risk is to that particular family member. I suspect in many cases, there are children who live in the same home as very elderly grandparents, for example, and that might be very, very different from living in a home with somebody who's on significant immunosuppressant medication. So there certainly will be variations in individual circumstances. But I think that we're hoping that, partly based on what Ronnie and others have said, that children do not appear to be super spreaders, that if we take the correct public health and hygiene in terms of frequent hand washing, in terms of physical distancing if appropriate, in terms of mask wearing if appropriate in the home setting, that those children will still have the opportunity to attend school, but there might be some extra additional precautions that will be put in place in those situations.
Thank you.
Jackie, do you want to try your question again?
You're on mute, Jackie.
Still pretty faint to hear you.
Oh.
There was a loud
Is that better?
Yes.
That's
Okay.
much better, thank you.
Okay. So I was just wondering if we could go back to a bit, just because Quebec released some guidelines saying that children should remain 1 meter apart and 2 meters apart. And I was just wondering if you think that would be unrealistic here for like teenagers and kids in high school.
Jackie, I'm afraid part of your question cut out. Maybe we could try just one more time.
Sorry. I was just saying that to try that here.
Maybe Jackie, you could briefly type your question in the chat box, and then we can answer it. I mean, I think I hear that it's something about physical distancing and the report about Quebec opening schools in September. What we're always missing is the specific question you have around it. So maybe can you just briefly type it in the chat box?
I just put it in the chat.
So I see it says, I'll read it out quickly. Quebec has released new physical distancing rules that say children under 16 should remain 1 meter apart from each other and 2 meters apart from adults. Do you think those rules are unrealistic for teenagers too?
Michelle?
Hi. So it's a good question, and I would just highlight that, you know, jurisdictions have taken a variety of approaches to school reopening, and they've implemented different measures to mitigate risk. And you'll see that there's some that suggest 2 meters, some that should suggest 1 meter. I think it's really important to note that it's not one specific measure that's going to reduce the risk alone. It's really the bundle of measures that will be critical in the school setting. And, you know, for that reason, we've emphasized, as Ronnie talked about before, really the hand hygiene and making sure that children aren't going to school when they're sick. I think with respect to the setting an actual distance, whether 1 meter is more practical and feasible than 2 meters, it's possible. But you know, as I said, we have put together this bundle, and that's our recommendation.
Jackie, if you have a follow-up, feel free to type it in. Otherwise, I don't believe that we have any other hands raised, but we do have just one more question from Dr. Chutter from TVO Kids. Dr. Cheddar, you can go right ahead.
You're mute, Dr. Cheddar.
Oh, I'm unmuted. Hello, everyone. Good morning. Dr. Cheddar here from TVO Kids. I have a quick question for Dr. Ronnie. Dr. Ronnie, what would you say to kids who might be afraid of going back to school at this time?
What a surprise for joining us here today, and thank you for the question. So what I would tell the children who are worried about going back to school is probably the following. I'm sure that most of you, if not all of you, are missing seeing your friends, and maybe most of you are actually missing going to school in person. And there are a lot of things we can do and put into place to make sure that when you go back to school, it will be as safe and healthy as possible for you, your friends, and your teachers. And I promise it will be wonderful for you to, again, see your friends, be with your friends and your teachers. And don't forget, make sure to always wash your hands and don't touch your face before washing your hands. And although I think all of you probably have done this already quite a bit, take the summer to continue practicing this as much as possible.
Thank you very much, Dr. Ronnie.
Okay, well, thank you everyone for joining our webinar today. If you have any follow-up questions or if you need any points of clarification, please feel free to reach out to the media relations team. And I think we will close it off there. Thank you very much.
Thank you.